let me tell you about my PhD topic, which is the comparison of the hormonal contraceptive methods and the route of administration. I'm Gábor Vleskó, and I work at the Department of Obstetrics and Gynecology as a specialist. My vision is to expand knowledge on contraception in the world so that every woman can avoid unwanted pregnancy. And the mission to reach this is to find new information that can help a wide population of women to choose the best option for contraception. I have two projects. The first is about investigating the efficacy and safety of combined parenteral, oral, and contraceptives. And the second one is about investigating the role of obesity on hormonal contraceptives. The first is a systematic review and the meta-analysis. We know that there's almost 2 billion women of reproductive age in the world, and 150 million women use contraceptive pills. So there's still a huge space for other methods. And there were studies showing that the effectiveness of a contraceptive method highly depends on the compliance with the regimen. There were studies that showed that every second woman tended to forget 3 or more pills per cycle when taking contraceptive pill. So the aim is to investigate the efficacy, the cycle control, the compliance, and the adverse events associated with the parenteral and oral methods. The question is that are these combined parenteral contraceptive methods as effective as the oral contraceptives? We had the PICO women of reproductive age. We investigated interventions where the transdermal patch and the vaginal ring compared to the traditional combined oral contraceptives. The primary outcome was Pearl index. It's an index measuring the efficacy of a contraceptive method. The lower Pearl index we have, the more effective it is. The secondary outcomes were compliance, adverse events. The hypothesis is that the parenteral administration of hormones is preferable to the oral route. It is more effective and has less side effects. Sorry. We performed a systematic search in these 4 databases. And at the end, we had 13 eligible full texts. And we were only searching for randomized control trials. Here you can see the primary outcome, which is Pearl index. The outcome measure is mean difference. And we can see that there was no difference between the parenteral group and the oral combined group. It means that parenteral methods are just as safe, just as effective as the proven and already known oral contraceptive with high efficacy. The compliance was a secondary outcome, and we found that we also performed a subgroup analysis, and we found a significant subgroup difference between the subgroups in favor of the patch, of the transdermal patch. So we found that the measure of outcome was alteration. We found that patch has a better compliance. So because discontinuation might affect the overall efficacy, women who had previous discontinuations due to other factors, we can encourage them to use a transdermal patch, which is just as effective, but comes with a better compliance. One adverse event was breast discomfort, and we found that there is an elevated risk of developing breast discomfort. We also performed the subgroup analysis, and there was a significant subgroup difference. The patch had a higher risk of breast discomfort. So this means that we can tailor the method. So patients having fear or having previous history of breast operation, or they have a fear of breast cancer or other things, which might lead to discontinuation if they develop problems with breast tenderness and other things. We might encourage them to use the ring instead of the patch in these cases, or to use the traditional oral contraceptives. Regarding nausea, we found that overall there's no difference compared to the oral group, but there is also a significant subgroup difference, so we can also tailor methods to the patient's needs. We also found that the vomiting, the same results. In terms of vaginal discharge, there was a significant, also the measure of outcome was odds ratios, so there's a 2 times higher risk of developing vaginal discharge, which might be uncomfortable and also might lead to discontinuation. So women having constant problem with vaginal discharge, as this might increase the risk of this, we either have to tell them that this might happen or try to suggest a different method. The strength of the study was that these were randomized control trials, and it's a comprehensive analysis of the different administration methods. The limitations were that there was no direct ring versus patch comparison, or only one, and there is no uniform way to report compliance or the adverse events. So the conclusion is that the contraceptive efficacy is similar, regardless of the way of administration, and the personalized choice can be offered to patients. The implication for practice would be this personalized contraceptive use, and we would need to try to improve compliance. The implication for research is that research is needed to try different drugs and also try to compare the different application forms, and also different application forms could be developed later. And this manuscript has been published last week in the Journal of Clinical Medicine. It's a Q1 journal. The second project is investigating the role of obesity on hormonal contraceptives. We know that by the end of this decade, there will be over 500 million people, and in every 5 women, 1 will be living with obesity. And this increased body weight and body fat might change the metabolic processes, also the contraceptive efficacy and the adverse events. So our aim is to investigate the efficacy and the side effect profile of contraceptive methods in overweight and obese women. The clinical question is that are these contraceptive methods less effective in overweight women and women with obesity? We had the women of reproductive age as a population, and we compared BMI over 25 to normal BMI. As primary outcome, we had efficacy, and we checked for adverse events. And the hypothesis is that the hormonal contraceptive methods are less effective in overweight women due to the altered pharmacokinetics. We performed a systematic search, and currently we are in this phase in the title and abstract selection. So summarizing the first manuscript was published last week, and we plan to submit the other in the middle of the year. I would like to thank you for your attention with the quote from William Osler that medicine is a science of uncertainty and the art of probability.
Congratulations for your publication. I have a question that you mentioned that we should improve the compliance of women. What kind of measurements would you suggest for clinicians, practitioners? How to improve it?
Well, I think informing patients should be one of the critical points, because as many papers suggest that women tend to discontinue a method due to small things like spotting bleeding. So I think that providing information leaflets or taking the time to inform patients about things might happen, that might increase compliance. So if we prescribe a vaginal ring and telling them that it might increase the vaginal discharge but doesn't affect the efficacy of the method, this might increase compliance. And also telling them, if prescribing a pill, but telling them that spotting bleeding might occur, or just telling them that if they miss one tablet, withdrawal bleeding might start, but this doesn't mean they have to stop the whole pill taking. This would be a huge improvement in terms of compliance. And there are other developing, so this vaginal ring, we just checked these, they need to change it quite frequently, so not every day, but there are currently developing vaginal ring which should be used for a whole year. Well, not continuously, so they can remove it and they can and wash it, but the same ring is used for one day, for a whole year. This might also improve compliance.
Thank you. I also would like to have a question that in your second study you are also gonna compare the different methods. I mean, like also the patch and the ring, or is gonna be only the oral contraceptive in the comparison with the?
Yes, the oral contraceptives, the patch, the ring, and also implants, and some of the not compared methods too.
What do you think? Which one is the better, the oral contraceptive or the ring?
Or the ring? Well, I think it depends on a lot on the patient itself and the patient population. So in my practice, what I see is that the younger women who have a faster life and a modern way of thinking, they accept the vaginal ring. And but there are some who have fears and or an incorrect knowledge of anatomy or something. So they are just they have a fear of inserting something into. They have a fear of losing it during a walk or sexual intercourse or something. I think that those women using vaginal ring, especially in northern countries, they love it. So somebody who gets used to it, they love it. And the main thing is, I think we have to encourage them, and so they have to step over the fears, and when they start using it, they like it.
So would you recommend it?
Yes, I recommend it.
And how would you persuade a young lady that she should use that? So what would you tell him? Why is it better than the oral contraceptive?
Well, it's.
So let's imagine there is a 26-year-old.
Yes.
Young lady, and she's coming to you, and it would be the first contraceptive method. And how would you recommend?
Yeah, it also
the ring?
has other advantages. So, like, they don't forget. It's if they drink, it surpasses the first pass metabolism. So it's not an oral way. So it uses the rectal veins to absorb, and also vomiting doesn't affect it. But the main thing is it's a longer term method. So the incidence of forgetting it during a party or something, or just living a faster life is less. And I would tell them they can remove it for a few hours when they have sex, and it doesn't. I usually tell them it doesn't have a bad effect on the male satisfaction. Some males say it's even better to have it during sex. So there were no studies on this, but that might be.
Okay, thank you.
Thank you, Joris. That's very interesting. By any chance, did you come across any study which was assessing I guess there is a huge estrogen level with the ring in the vagina locally, much bigger than if you use systematic hormones. And does it affect, by any chance, the lactate production by stimulating more and more of the precursor of lactates?
In the vagina?
Yeah, locally.
Well, there was one study that suggested that even there's an increased vaginal discharge, but it might not be a disadvantage because they found higher lactobacilli
that's
population in this vaginal discharge.
Okay,
But we wouldn't suggest women to improve the vaginal flora with vaginal ring. But this
Why
is
not?
a side effect that might be also present. Yes.
Okay, thank you.